Hello and welcome to Health Tips TV. Today, we are going to talk about antibiotics, powerful medicines that have saved millions of lives, but can also cause serious harm when misused. Many people take antibiotics without proper medical advice, stop them too early, or use them for illnesses they cannot treat. Antibiotics affect the body, the dangers of using them incorrectly, and the correct way they should be taken to protect your health. Please stay with me until the end, because this information could save your life or the life of someone you love. Antibiotics are medicines used to treat infections caused by bacteria. Bacteria are tiny living organisms that can enter the body and cause illnesses such as pneumonia, urinary tract infections, typhoid, and some types of diarrhea. Antibiotics work by killing these bacteria or stopping them from multiplying, which helps the body's immune system fight the infection and recover. It is important to understand that antibiotics work only against bacterial infections. They do not treat viral illnesses like the common cold, flu, COVID-19, or most sore throats. Taking antibiotics when they are not needed can cause harm instead of healing. Antibiotics have positive effects when they are used correctly and under medical guidance. 1. Kill harmful bacteria. Antibiotics work by killing bacteria that cause disease or by stopping them from growing and multiplying. This helps remove the infection from the body and allows the immune system to recover. 2. Reduce the severity of infection. When antibiotics are taken at the right time and in the correct dose, they reduce how serious an infection becomes. Symptoms such as fever, pain, swelling, and weakness improve faster, helping the patient feel better sooner. 3. Prevent complications. Untreated or poorly treated bacterial infections can spread to other parts of the body and cause serious problems such as organ damage, blood infections, or long-term disability. Proper use of antibiotics helps prevent these dangerous complications. 4. Save lives, especially in serious infections. In severe infections like sepsis, pneumonia, meningitis, or severe wound infections, antibiotics can be life-saving. When given correctly and on time, they stop infections from becoming fatal. Antibiotics can be life-saving and very helpful when used correctly. They can also cause serious problems if they are misused or taken without a doctor's guidance. Let's look at some of the side effects and dangers you need to know. Common side effects of antibiotics: 1. Nausea and vomiting. Antibiotics can irritate the stomach lining and digestive system. Some antibiotics also affect the normal balance of digestive enzymes, which can trigger feelings of nausea or lead to vomiting. Viewer-friendly tip: this is why some people feel sick or throw up after taking antibiotics, especially on an empty stomach. 2. Diarrhea. Antibiotics not only kill harmful bacteria but can also disturb the good bacteria in your gut that help digest food. This imbalance can cause loose stools or diarrhea. Always drink plenty of water, and talk to your doctor if diarrhea is severe or persistent. 3. Stomach pain. The irritation of the stomach lining combined with changes in gut bacteria can lead to cramping or stomach discomfort. Taking antibiotics with food, if your doctor allows, can sometimes reduce this discomfort. 4. Skin rashes. Some antibiotics can trigger an immune response in the body, causing a rash or redness on the skin. This is usually mild but can sometimes signal an allergy. If the rash is severe or accompanied by swelling, contact a doctor immediately. 5. Allergic reactions. The body's immune system may mistake the antibiotic as harmful, releasing chemicals like histamine that cause itching, swelling, or hives. Severe allergic reactions are rare but serious. Medical attention is needed right away if breathing is affected. Serious effects of antibiotics, usually from misuse. 6. Damage to gut bacteria. Long-term or repeated use of antibiotics can kill beneficial bacteria in your digestive system. This can lead to chronic digestive issues, weakened immunity, or even yeast infections. This is why doctors sometimes recommend probiotics after a long course of antibiotics. 7. Liver or kidney problems. Some antibiotics are processed by the liver or filtered through the kidneys. Overuse or incorrect dosing can overload these organs, leading to temporary or permanent damage. People with pre-existing liver or kidney problems must be extra careful and follow the doctor's prescription closely. 8. Severe allergic reactions, rare but dangerous. In very rare cases, the immune system can go into overdrive, anaphylaxis, causing swelling of the throat, difficulty breathing, rapid heartbeat, and low blood pressure. Tip: this is a medical emergency. Call emergency services immediately if this happens. Antibiotics are powerful medicines, but using them the wrong way can be dangerous. Let's take a closer look at what counts as misuse and what it can do to your health. Misuse of antibiotics. 9. Taking antibiotics without a prescription. How it happens: some people take antibiotics for colds, flu, or other illnesses that aren't caused by bacteria. Effect: this doesn't treat the illness and exposes your body to unnecessary medication. It also gives bacteria a chance to become resistant. 10. Not completing the full dose. How it happens: many stop taking antibiotics as soon as they feel better. Effect: some bacteria may survive and grow stronger, making the infection harder to treat next time. 11. Sharing antibiotics with others. How it happens: giving leftover antibiotics to friends or family for their sickness. Effect: the dose may not be right for their infection, or it may be the wrong antibiotic entirely, which can make bacteria resistant and infections more serious. 11. Sharing antibiotics with others. How it happens: giving leftover antibiotics to friends or family for their sickness. Effect: the dose may not be right for their infection, or it may be the wrong antibiotic entirely, which can make bacteria resistant and infections more serious. 12. Using leftovers from past illness. How it happens: taking antibiotics saved from a previous illness instead of seeing a doctor. Effect: the infection may not be treated properly, and bacteria can adapt, becoming stronger and resistant. Effects of misuse. 13. Antibiotic resistance. Bacteria become stronger. Explanation: misusing antibiotics trains bacteria to survive. They change in ways that make the medicine ineffective. Viewer tip: resistant bacteria are much harder to kill, and common antibiotics may no longer work. 14. Infections become harder to treat. Explanation: when bacteria are resistant, doctors must use stronger, more expensive, or riskier antibiotics to cure infections. 15. Longer hospital stays. Explanation: resistant infections take longer to heal, often requiring hospitalization to monitor treatment. 16. Increased medical costs. Explanation: stronger medicines, longer treatment, and extra hospital care all cost more money. 17. Risk of death from resistant infections. Explanation: in severe cases, infections caused by resistant bacteria may not respond to available treatments, which can be life-threatening. Now that we know the benefits and dangers of antibiotics, let's talk about the correct way to use them to stay safe and healthy. Do's: how to use antibiotics safely. 1. Take antibiotics only when prescribed. A doctor will determine if your illness is caused by bacteria and choose the right antibiotic. Taking them without a prescription can be harmful. 2. Follow the exact dose and timing. Antibiotics work best when taken at the correct dose and intervals. Skipping doses or taking too little can let bacteria survive and become resistant. 3. Complete the full course, even if you feel better. Stopping early may make the infection return and stronger. Completing the course ensures all harmful bacteria are eliminated. 4. Take with or without food as advised. Some antibiotics may irritate the stomach if taken on an empty stomach, while others are absorbed better without food. Follow your doctor or pharmacist's instructions. 5. Report side effects to a healthcare provider. If you notice nausea, rash, or any unusual reaction, inform your doctor immediately to prevent complications. Don'ts: what you should never do. 6. Stop early. Explanation: even if symptoms improve, stopping can leave bacteria alive, causing relapse or resistance. 7. Skip doses. Missing doses gives bacteria a chance to survive and adapt, making future infections harder to treat. 8. Use antibiotics for viral infections. Explanation: antibiotics do not work against viruses like colds, flu, or COVID-19. Taking them unnecessarily is harmful. 9. Share medicine. Everyone's infection and body are different. Sharing antibiotics may give the wrong dose or drug, putting others at risk. By following these simple rules, you can get the full benefits of antibiotics, avoid harmful side effects, and help stop antibiotic resistance. Always use them wisely. Above all, I have a special advice for children and pregnant women when it comes to antibiotics. Their bodies are more sensitive, so extra care is needed. 1. Antibiotics must be carefully selected. Children and pregnant women have developing bodies that may react differently to certain antibiotics. Some medicines can harm a baby's growth or a child's organs. Choosing the right antibiotic ensures the infection is treated safely without putting the child or unborn baby at risk. 2. Incorrect use can cause serious harm. Giving the wrong antibiotic, the wrong dose, or stopping treatment too early can lead to complications like allergic reactions, organ damage, or treatment failure. Why it matters: their bodies are more vulnerable, and mistakes can have long-lasting effects. 3. Always consult a doctor. Only a healthcare professional can decide the safest antibiotic, the right dose, and the correct duration for children or pregnant women. Self-medication or using leftover medicine can be extremely dangerous for these groups. So remember, antibiotics are powerful medicines that can save lives when used correctly. Always follow your doctor's advice, complete the full course, and never misuse them, especially for children and pregnant women. In conclusion, antibiotics are powerful medicines that can save lives when used correctly, but they can also cause serious harm when misused. Always take antibiotics only when prescribed, follow the correct dose and timing, and complete the full course. By using antibiotics wisely, we protect our health and help prevent antibiotic resistance. Thank you for watching this video on Health Tips TV 1. Let's meet again in our next video with more important health information. Stay safe and take care.